Hi, I am Dr. Kim Sage. I'm a licensed clinical psychologist. Welcome to my YouTube channel, and you might just be hearing the birds chirp. I don't want to close my windows because it's so beautiful outside. So wherever you are today, I also hope you're having a good day. And if you're not, I hope that in some tiny little way this video validates your pain and struggle and your story, no matter where you are in your journey. If you're new here, please consider subscribing and checking that little box and that little bell thing. And that way you'll get notified when I post new videos. Right now I'm posting Monday through Friday on this series called Wildly Loved. And this channel is really all about helping you heal from childhood and attachment and trauma, and really how complicated childhoods often set us up to have struggles. And so we are right in the middle of that right now, talking about the impact of parents who may struggle with some form or combination of borderline or narcissism, or often even called emotional immaturity, but really just a lack of predictability, a lack of consistent available emotion, or conditional emotion, right? It could really vary. But that's the heart of what we're doing right now. And I want to talk specifically about how borderline and narcissistic type family dynamics impact us as children, and how that is often what we are struggling with as we are in our trauma brains of childhood, in these adaptations, these survival mechanisms we developed that served us in childhood, but don't serve us and are not serving us in our adult relationships today. Really quickly, if you are someone who says, yes, I do think my parents may have had these disorders, please check out my courses down below. They are specifically for you. Okay, so let's talk about how we're getting a little bit, deeper into how we become what I call feelings holders, as in this video from yesterday, and then really become these sort of manifestations of the ultimate caregiver, the sacrificial lamb who will just take whatever it is to just, in the service of everyone else, be this wonderful, loving presence. Especially if we are determined to not be like our parents, we can sort of get caught up in trying to be so good and not them, that we wake up, like I've shared, with patterns that I repeated, or in terms of choosing unhealthy partners. I don't behave like my parents, but I still feel a lot of the stressors of childhood because of my anxiety, because of the way my life played out, because I wasn't very healed at all when I began my journey as a partner and parent in my early years. But really what happens is we are set up to be these caretakers. And the issue here is that as we are rotating around these kinds of parents, really sacrificing our own needs for the sake of their survival, because as children, they often put us in the role of adult caretaker, right? We have to help mommy or daddy or parent with their feelings, or be their best friend, or manage the household, or take care of ourselves. But we're also taking care of them while we take care of ourselves, more than we really should, on both ends, right? And so as a result of that, that sets us up to be so mindful about the parent who struggles. Now, because those who suffer with disorders like borderline and narcissism for different reasons can have this core sense of fear of abandonment for borderline, and really deep worthlessness and self-esteem for narcissists often, and a need to have control and power to often heal their own wounds, they have these deep fears as well. And so they, on the one end, they so want to be adored and loved and seen. And oftentimes on the flip side, they also have these fears of being too close to somebody, especially with borderline, of being consumed. And so they basically see their needs in others in that splitting dynamic, which I've talked about in many videos, which is very common in borderline, but also can be present in narcissism, which is this idea that we idealize people or things or the world and relationships, and then we devalue them. So you are either the good child or the bad child, the great husband or the worst husband, right? The best wife, the worst wife. And what this book talks about, I'm using this quite a bit this next few videos, get it out. This book here, and I'll link down below, or you'll see it here, actually not linked down below, but on my website on drkimsage.com. I have all the books I recommend. They use the words that you are, and this is even true if you're the child, but really true as you become a partner, you're either the savior or you're the enemy, right? And so you're back and forth between you're going to save me and not leave me and fill up my life, or you're going to, be some meaningful reflection of my value, like a narcissism, or you are the worst. You don't love me, you don't care about me, you're selfish, you're horrible, you're mean, whatever. And so we have been holding as children this dynamic our whole lives. And what I say to patients a lot of the time is then we internalize that. That splitting that they do to us, we put on ourselves. And so we often will see ourselves as either saviors or enemies to ourselves, to the world, and relationships. And because we have this power when we're the saviors, and because we did get relied upon, we have this false sort of belief that we cannot abandon anyone who's suffering, that we can actually help them. And so this narrative often plays even on a very unconscious level, but that we don't abandon people, we stay. But then at the same time, they can make us out to be the enemies. And so we're holding the savior and the enemy inside too. And part of what makes it so difficult to really do this work when you have a parent, especially with borderline, is that, we're with narcissists, like you really, a full-blown narcissist as a parent, you never really feel seen ever. It's very conditional. They never really get you. But with borderline, as I keep saying, it can and may feel like that at times. You can be so close to them and then be the worst child ever. And so what's happening is that you've internalized that you do have some saviorness about you. I like to make up these words, right? And so we are able to not abandon people, and so we shouldn't. And we've seen them suffer, but then we've also seen them say they're sorry or be better. And so that makes this work, as I was saying, so much more difficult when you're trying to realize, God, was that my parent? Like, I love them so much, but I also hate them, and that feels terrible. Which I truly believe, when you feel that very strongly, is often a very big sign of borderline. Or you just always felt hated. That can be both narcissism and borderline. Of course, I'm talking about untreated in all of these cases. But so we have become this sort of savior. We don't abandon ship. We are peacemakers and soothers and healers. And that's kind of our role. Even if, like, for me, I was the only child, I was still that best friend at like 8 or 9, hearing conversations about partners and what was happening, and having, trying to make mommy happy and dad happy in ways that were a true burden psychologically. But I have no doubt they played into my chosen profession, as many, many people in the helping professions have come from these kind of families where they play these roles. And so we've learned we can create calm in a storm, and we can diffuse conflict. And so we get this sense of meaning and value, like I'm saying, this saviorness, right? And so, like our parents, we kind of are getting rewarded for this role we're playing, and they're getting rewarded in a different way, like they're getting their needs met, I should say. And our needs are getting met as a result of sacrificing our own wants and needs in the service of theirs. And so our low self-esteem, our fear of conflict, and our desire and longing to truly be loved and seen for who we are, that sets us up to then choose partners in our adult world who, we are happy to like not speak up, and happy to give you what you want, and happy to sacrifice to make you feel okay. And in some weird way, we're so used to doing that it makes us feel like we're doing what we're supposed to be doing, right? We feel a bit in control of this sort of uncontrollable world of our childhood. And so we've really honed this empathy and compassion and self-sacrifice, because after all, these parents, they chose us to confide in. And we felt, a lot of kids will say, yeah, when mom or dad or parents started talking to me about their adult problems over the other siblings, I felt so like important and like I was an adult and it was meaningful. And all of that, it makes us feel like we're doing what we're supposed to be doing, and it makes it so much harder to set the boundaries and to walk away and change those relationships with those parents, especially if we're in a very active relationship with a borderline or narcissistic parent. And so we stay in it, right? We just stay in it. We feel like we have this push-pull between what we can bring and our value. And in that chaos, in some way, it feels like home. And so if this is you, I would really encourage you to take a moment and pause and reflect on, what happened in that role for you. When you look at why you're so compassionate, why you're empathic, why you're a caretaker, why you sacrifice yourself, why you avoid conflict. Is there a relationship to what happened to you in childhood? And if so, how and where did that happen, right? That's the first part, to understand, I can look back now and see that I was the one that would sit between my parents and try to calm their conflict, or I would yell at both of them to stop fighting. And sometimes they would listen to me, right? Or I just felt like it was my responsibility, even if they just kept raging. Or when mommy would cry at night, I would go into her room and, and I would make her feel better. And that made me feel good that I could help her or dad or whatever. So try to explore that, and then try to look at where might you be transferring the same skill set that you learned in your adult life. And maybe it is in your job, and maybe that's a great thing. But make sure, for example, if you're let's say you're a therapist or a helper or a teacher, doctor, that you don't do it to the extreme where you sacrifice yourself. And I'll bet you, for the most part, most of us who do this work, we have to really work on setting boundaries, holding ourselves accountable, finding a sense of self outside of our job. Because so many of us throw ourselves into these professions because they're demanding professions in terms of our emotions, and we get so much out of it, we're so used to it, and it also feels really good. But, there's a point where it's not just about who you're helping, it's also about what's happening for you. And I would argue that we can't bring our best selves to our patients, to our students, to our staff, if we're managers or whatever, if we're not working on ourselves. And that's something that I'm still working on and will always be working on, because it really has been my go-to. Then having 4 children and raising them, on my own, all of these things have had a huge impact. And so that's really what it is, right? It's trying to figure out, where do I do this and where am I doing it now? And looking at those relationships today and evaluating where I want to continue doing that and where I need to set boundaries and be more mindful of my own heart and my own health and my own life. So thank you so much for watching. Please stay safe and well. And tomorrow we're going to talk about the job of the caretaker and go a little bit deeper into sort of how all of that plays out, especially around hypervigilance, as we discussed a few weeks ago, and our hyper-intuition. And so I will see you tomorrow. Thank you so much for being here, and please stay safe and well. Bye, guys.